อาจารย์สายพินครับภาพตรงนี้ก็จะเป็นภาพแห่งความทรงจำอีกครั้งหนึ่งนะครับที่พวกเราได้อยู่ด้วยกันนะครับ
ยังมีหลายกล้องค่ะยุคเทคโนโลยีกล้องเยอะนิดนึงนะคะค่ะภาพประวัติศาสตร์อีกแล้วนะคะขอบพระคุณนะคะขอบพระคุณท่านกรรมการทุกท่านนะคะในโอกาสนี้ก็ขอเรียนเชิญ
ครับลำดับต่อไปนะครับลำดับต่อไปครับเป็นปาฐกถาพิเศษในหัวข้อทิศทางการพัฒนาเวชศาสตร์ครอบครัวในประเทศไทยจากมุมมองที่หลากหลาย CEO of Wonka Viewpoint on Family Medicine Development Part in Thailand โดย Dr.Garth Manning Chief Executive Officer of the World Organization of Family Dr. Wonka Dr.Garth Manning please
Thank you very much indeed. And my thanks to Pakon and Orawan and to all the other organisers for inviting me here this morning. I'm delighted to be here and to see so many familiar faces. It really is a real treat for me. I'm just waiting for my slides to appear. Are they going to appear at some point? Excellent. Well, I was here I was with you 2 years ago at your conference at the Rose Garden in a slightly different existence. At that point, I was with the Royal College of General Practitioners of the UK. But 2 years on, we've all grown older, we've all moved on, and I'm now the Chief Executive Officer of Wonka, the World Organization of Family Doctors, based here in Bangkok. I've only got 15 minutes, so this is going to be only scratching the surface of family medicine and family medicine in Thailand. But I want to talk just a little bit about Wonka and its role, and for you to see how that fits with your aims and objectives for how you want to move the family medicine agenda forward in Thailand. People often wonder where our funny name comes from. What does Wonka mean? Well, originally, it was the World Organization of National Colleges, Academies, and Academic Associations of General Practice or Family Medicine. So we got Wonka from the first 5 initials. The name has stuck and has become, it's got a very good recognition, but we're now more usually known as the World Organization of Family Doctors. Thailand was into Wonka right from the very outset. The first Wonka conference was in 1972, and there were representatives from Thailand at that conference. And of course, the Royal College of Family Physicians of Thailand is a full member organization. And I hope very much that we might see you joining the Wonka family at some point in the future. Wonka has 126 member organizations in 102 countries. We have 320,000 members across all continents of the world. So we really do have an international spread. Like all good organizations, we have a mission statement, and that is the Wonka mission statement there. And I hope over the next few minutes to show that the aims and objectives of Wonka in trying to promote family medicine internationally are the same aims and objectives that you have for promoting family medicine within your country, and that we're all aiming for the same goal of good, professional, quality family medicine for the population of the country that we serve. So what Wonka's trying to do is to promote personal, comprehensive and continuing care for the individual and the family in the context of community and society. Now, the late, great Barbara Starfield, who did so much research to produce the evidence that we need to convince our policymakers, Barbara Starfield showed conclusively that countries with strong primary care systems have better health outcomes, greater patient satisfaction, lower prescribing, and healthier populations. And the higher the ratio of family physicians to the population, the lower the hospitalisation. And hence we are a cost-effective system. Equity is very important to Wonka. Promoting equity through equitable treatment, inclusion, and meaningful advancement of all groups of people, particularly women and girls, in the context of all healthcare. Equity is difficult to measure, but again, Barbara Starfield comes to our rescue, and she showed that if you increase the number of family doctors, increase of one primary care doctor per 10,000 population results in 1.44 fewer deaths per 10,000. So there is evidence there that family medicine helps to improve health. And that was particularly noticeable among the African American population. And we know that the more we can promote health among women and girls, it's less relevant in Thailand, but in so many parts of the world where women really struggle. If we can improve their health, we improve their industrial output, we improve the economic health of the nation. Wonka supports the development of academic organisations, and that's really important. As I said, Starfield showed that countries with strong primary care systems have better health outcomes and so on. But that only applies if we have highly trained generalist physicians. It's no use taking a young doctor fresh out of medical school and putting them in the community and expecting them to function, because they can't do it. We need multi-skilled, competent generalists based on rigorous preparation or training, deliberately based on the needs of the population they serve. And there is a degree of arrogance among our hospital colleagues who feel that somehow we're just generalists and that anybody can go out and be a general practitioner or family physician. It is probably one of the most complex and complicated roles that there is in medicine. One of Wonka's big things is to help to exchange knowledge and information. And we provide a forum for those exchanges between member organisations and between GPs, and we do that in a number of ways. There's world and regional conferences, and next month the triennial, three-yearly World Conference will take place in Prague in the Czech Republic, and that promises to be a really good conference. But there are also regional conferences too. Next year it'll be in Kuching in Malaysia for Asia Pacific. The following year it's in Taipei. And in 2017, it's here in Thailand. And that's a fantastic opportunity to meet with doctors from other countries, to learn from them, for them to learn from you. And in many ways, it's a reassurance to discover that you're not alone, that the problems that you face are actually common to so many of your colleagues in other places. But Wonka also has research networks, working parties, special interest groups. So we've got working parties in education, in research, in the environment. We've got special interest groups in care of the elderly, in palliative care. So there are a whole lot of other subgroups to attract your particular interests. There's the young doctors movement, and most regions of Wonka have a young doctors movement. In Asia Pacific, it's the Raja Kumar movement, and that's very active as well. And we also have internet forums. And the final thing that we do is to represent the policies and the educational, research and service provision activities of family doctors to other world organisations and forums. Now that's particularly true with WHO, and we work very closely with WHO. Tomorrow I will be flying to Geneva to take part in the World Health Assembly, along with some of my colleagues. But we also work with ministries of health, with health insurance organisations, with the World Medical Association, and with other international organisations. We're collaborating more closely, for example, with the International Coalition on Occupational Health, and we're jointly looking at work-related health and how primary care might be able to help that. So in all of this, how is Thailand doing? Well, we all face a number of primary care challenges. And I'll go through these and one by one suggest how I think Thailand is doing. First thing is the problem of inverse care. Essentially, those who need care most get it least, and vice versa, often because of lack of access to affordable care. And this is one area where Thailand has done supremely well. And I'll talk in a moment about universal health coverage. But the coverage that is provided to the population of Thailand is a model, frankly, for the rest of the world. It is fantastic. And of course, inverse care leads to impoverishing care, because if there isn't care that is free at the point of delivery or at a cost that most people can afford, then, and if care has to become an out-of-pocket expense, then a health problem may lead to catastrophic expense, which destroys the family and the family unit. So again, Thailand is doing really, really well. Fragmented care, though, and this is where there is excessive specialization and a focus on specific diseases, which discourages a more holistic and continuing approach to health services. And here I'm not so sure. There is still, particularly I think in the cities, there is too much access to hospital, there is too much use of specialization and subspecialization, and we've got to try to get the population away from that idea. There's misdirected care, where resources from whichever source are directed much more towards acute and curative services, and they often neglect primary prevention and health promotion. Thailand's doing reasonably on that. Some budgets for health promotion are ring-fenced, and I think there's some really good health promotion work going on here, better than in many countries. So I think we'll give a tick for that. And the final thing is unsafe care, which is really where there are badly designed systems and unsafe practices. Hospitals are dangerous places. If people go into hospitals, there is a risk of hospital-acquired infection. There's a risk of errors. There's a risk of adverse effects. Multiple doctors through hospital settings leads to over-investigation, over-procedures, over-treatment. And it will probably not surprise you to know that the third most common cause of death in the United States is doctor-induced. Because every time somebody goes into a hospital and every time they have an investigation or a treatment, there is a morbidity and a mortality associated. The more we can keep people out of hospital and the more we can manage them in the community, the better we can help with this. Believe it or not, it was 5 years ago when the seminal World Health Report, Primary Healthcare Now More Than Ever, was published. But it really was seminal in a number of ways, because ever since Alma-Ata in the late 70s, WHO, as I had rather gone away from primary care, and it was good to see primary care emphasized one more time. And the World Health Report looked particularly at 4 areas. So it looked at universal health coverage, to ensure that health systems contribute to equity and end exclusion on the basis of things such as income and ethnicity, and to invest adequate resources for maintenance of a robust primary health system with universal access. And I would suggest that Thailand is probably #1 in the world for having introduced universal health coverage to the extent that it has. To have done it so quickly and so efficiently to the extent where people now do not pay for care at the point of delivery is a massive, massive achievement. And Margaret Chan, who's Director General of WHO, has made universal health coverage her primary goal for her second term of office. And the Wonka hierarchy met with her about 6 months ago, and she emphasized particularly how important universal health coverage is to her. And we emphasized to her that good universal health coverage is only possible if you've got good family doctors. The World Health Report talked about public policy reform and about how it was essential to integrate public health and primary health care, to ensure greater collaboration between the various stakeholders. So in other words, what is the patient's agenda? What is the community's agenda? What do they think is important? And it's important to have that dialogue. And I think a lot of the work that's going on here through Dr. Young-Yut and others is working really, really hard to try to achieve those aims. I think there are areas that still need to be improved, such as recruitment, training, deployment and retention of health professionals. But I think there is still a lot of good work going on. The third area looked at leadership and research to try and reach a consensus based on the values of solidarity, social justice and accountability using best available evidence. And again, I think there is progress, but there is more to be done here. And finally, service delivery and educational reforms. So to reorganize health services with teams of health workers delivering people-centered, culturally appropriate, community-based health promotion, preventive services and primary care. To make sure that family doctors